deal thing on there. So email me and say, email me, and then we go and have it. And if there's others that go from the little restaurants.
They bring out really good shots.
Yeah.
Nice to meet you. Here's you.
He's very, very
Hi, everybody. We'll get started in just a few minutes. Everybody can start taking their seats, and the panelists can come up to the stage. This crowd quiets down really nicely. Wow, that's impressive. I've worked in a lot of crowds where I'm invisible. So thanks. We're just getting set up here. While we're doing that, I'll start by just thanking everybody, thanking all of you so much for coming out early. I'm a morning person, but I recognize not everybody is, and so I really appreciate you getting out for this important conversation as part of our Candid Conversation series of important public policy issues. I'm Chris Cobbler. I'm the publisher and CEO of the Fort Worth Report. We're just delighted to be able to bring our live journalism to you. I also want to start by thanking our staff they're scattered around this ballroom. We've got our reporters who make all this happen. I mean, really our success we've had in the past 3.5 years have to do with all the great stories that they've done during that time. So if you wouldn't mind, help me in thanking them, give them a round of applause for that. And today we've got UTA Benicio Cinta over there back. He's live streaming for us. So we really want to thank our friends at University of Texas Arlington for that. This will be, after it's been live streamed on our Facebook and YouTube page, it'll be on our website at fortworthreport.org, so you'll be able to capture that later for those who can't make it too. And then, of course, I want to thank Texas Wesleyan, our host for most of our Candid Conversation series, and introduce the Provost and Senior Vice President of Texas Wesleyan, Dr. Hector Quintanilla, to say a few words for us.
Thank you, Chris. Excellent pronunciation, man. You are a morning person. Welcome to Texas Wesleyan University. We're so happy to have a partnership with the Fort Worth Report and having them right across the street nearby, so we get to collaborate with them many times. And welcome to our distinguished panelists this morning. And I want to thank you all for being here, and if this is your first time to Texas Wesleyan campus, please let us know in any way we can make your visit more comfortable. Many of you as engaged citizens of the community know that higher education is expanding, right? There's all kinds of activity here, either planned or current in the community. And here at Texas Wesleyan, we are also feeling some of the effects of that expansion and growth in our community. This year, we had our 4th consecutive year of enrollment growth. We also had our largest degree-seeking population, and within that, our largest domestic population of degree-seeking students in the history of the university. So we're very thankful for that support, and of course, having served this part of the fourth sector since 1890, we have a long tradition of serving not only Tarrant County, but the southeast sector of Fort Worth. Speaking kind of along the theme of large and healthcare, many of you may not be familiar with our nurse anesthesia program, which is the largest in the nation. So we have approximately 300 students studying here at Texas Wesleyan to become certified registered nurse anesthesiologists and anesthesia providers there. Anyway, and then I would be remiss to say, we have our own growth going on here in terms of construction to the west side of the campus. We have our stadium project is ongoing, and this year our football team is 6-0 and ranked 11th in the nation in the NIA. So we're very proud. So once again, thank you all for being here, and hope you have a great morning and rest of the day.
I think Jerry Jones might want to stop. Maybe get a few pointers. All right, well, and we so much value our university collaborations, because our next presenter is going to say a few words is Dr. Stuart Flynn. He's the Dean of the Burnett School of Medicine at TCU. We got Wesleyan, we got TCU, we've got everybody covered, and we're so thrilled to have Dr. Flynn here to sort of set the stage for the conversation.
Well, thank you, Chris, and welcome everybody. We're not going to talk about our team's football record, but grateful. So I really want to thank Chris, the Fort Worth Report, for bringing us all together for what I think everyone in the room will agree an incredibly important conversation. It's relatively somber, but we're looking forward and we're going to make a difference in that regard. I also want to thank Texas Wesleyan University for hosting us in this absolutely beautiful facility, so thank you. So I am Stuart Flynn. I'm the founding dean of the Burnett School of Medicine at TCU. I'm really honored to kick off this meeting. Chris asked me how many minutes I was going to talk. I did not tell him. So it will be a surprise, both to him and to me, quite frankly. So, but in my capacity as the dean, I get to play a role in training the next generation of physicians. And as a member of the Fort Worth and Tarrant County Maternal and Infant Health Coalition, which we're going to talk about a little bit today, I also am very honored to play a role in that. And I will share with absolute sincerity, I've been here less than 9 years now. What is happening in this room and with this topic and with partners and with the Fort Worth Tarrant County Coalition is the singular most impressive thing I've seen since I've arrived here. And this does not happen in other places I've been. So I just have to share that. This is impressive. You're about to hear some amazing progress and forward-looking opportunities. The coalition consists both of local major hospitals and a wealth of community-based organizations. And due to the phenomenal leadership of Mayor Matty Parker, who got us together 2 years ago, and as Mayor Parker is very good at doing, with a very nice smile on her face, looked at all of us and said, this is unacceptable, and I'm challenging you to do something better. So that was a little over 2 years ago. And it's pretty impressive, the progress that's been made. And so I think we all owe her a strong debt of gratitude for championing this. I was asked yesterday by a national TV network, why should your community care about this? Why is it so passionate? And I know that question was meant to be provocative, but we are passionate about it. Some have means for maternal and infant care, and others don't. So the question may have been provocative, but I certainly let it be known this is a social, a public health issue. It's not just individuals who can't access things like others can. The statistics we'll share today, and I've just been asked to share a few to not put all the burden on the panel. And then the panel asked me not to steal all their thunder, which I'm also unfortunately pretty good at doing. But what you'll hear today is the negative numbers are very disproportionate among our African American and our Hispanic mothers and families. So that's just a backdrop. Tarrant County has the second highest maternal mortality rate for Black mothers in our state. And unfortunately, it's just about that high in our country. So this is why Mayor Parker was indignant that this is what's happening in our community. Texas accounts for 10% of all births in our country. They are only second to California in numbers. And in Tarrant County, there will be 27,000 live births this year. And when you put that on just a graph of states in the US, it puts us well above 10 states in this country. So our county is bigger than several states in our country. 53% of all births in Tarrant County are either to Latina or Black moms. And with absolute symmetry, 53% of all of our parents who birth in Tarrant County are either on Medicaid or they're uninsured. So you can start to see how this picture gets painted of why we struggle to move forward. Additionally, our rate of severe obstetric complications, which is defined by the government, we are the highest in the nation. So this is why this is both a very serious conversation, but then it's one, what are we going to do about it? You're about to hear from the panel some of the things. So it's an understatement to say this conversation is long overdue. And I will just highlight on another example that is just really important and severe and significant is the mental health conditions of our moms, leading cause of pregnancy-related deaths. So our coalition, valuing a research team from the University of Michigan, that just happens to be my alma mater. That's not why we hired them. And we're also not going to talk about their football season either. So let's move on from that. They interviewed over 100 moms, and 56% of the moms said that they want and need more support after birth, including and related to mental health. These data are a snapshot as to why Mayor Parker formed and then challenged the coalition to make a difference. Our healthcare partners, which you're about to hear, are all in, and they're devoting immense time and immense resources to addressing this societal huge problem. Early, the coalition engaged a consultant to help build a comprehensive resource map to demonstrate which services our community has for moms, therefore which ones we need to build, from conception to a year out postpartum. They did a phenomenal job, and the good news was when we opened the envelope, we have a very robust network of services. Very robust, impressively robust. The bad news, many moms don't know about these services. So we have them, they don't know about them. Also, our providers refer moms to these services, but then we have no idea if the moms actually participate. So the referrals are made very appropriately, very genuinely, but then we don't know what happens at that point. So This observation has led to a shared goal and a shared strategy to what is referred to as closing the loop. Don't leave that loop open. Always know the handoffs have happened. Any handoffs that are driven, that we know that the handoff occurred and the mom went to the next thing. So with that in mind, I just want to talk for a second. I think you have a flyer on your table about Parent Pass. So Parent Pass, with excitement and pride, and I'm not looking to my right because they're the leaders who helped design this and get this up and running. But it's an app developed right here for Fort Worth families. I think it now has over 10,000 families who are using it. She had to talk. I didn't even look at her, and I hear her voice over that 12,000. Sorry, the latest tally just came in. It's 12,000. So and it will grow, and it's sustainable and it's scalable. That's what's very important. Doesn't just have to be here. So and partnering with Help Me Grow and their specialist navigators, the coalition is embarking on building a comprehensive ecosystem of support and care for moms. The support starts with training nurses across our health systems to help moms download the app. They can't use it if they don't download it or know about it. And then they have access to free resources and critically, the ability to chat one-on-one with child specialists. And we heard this from the moms when we talked with them. Thus far, we have shown that 90% of the moms, I'm waiting for an update. She is killing me. And she's the one who asked me to talk today. And so there you go. This is payback. So 91% of the moms have been able to contact the services they need. And reiterating the close the loop objective, we are confirming with the provider and the mother that these services were in fact completed. In our vision to give every mom and baby the best start possible, we're already seeing successes in regards to these efforts. So I'll close by sharing on behalf of all working tirelessly within the coalition, a huge thank you to all of our healthcare providers, our amazing community-based organizations. They are making a difference already. I also want to thank Mayor Parker for her truly phenomenal leadership from my personal point of view. She is not here because she is giving a State of the City address just in a couple hours. I am not going to preempt her speech, predominantly because she would not share it with me. So she is a very wise woman because I would have shared some of the things, but she is going to talk about this coalition. I think she's proud of the progress we've made. So let me close by saying thank you for hosting this, for being here. And now I want to hear from the panel like the rest of you do. I hope I didn't steal too much of their thunder. So thank you.
Thanks so much. I'm right here. You're good. Thank you all. We have one more introduction to make, but it's a really important introduction. So I'm just so pleased and honored to introduce Shannon Fletcher of JPS. JPS is our presenting sponsor today. And obviously, they've been a big factor in making all this important conversation happen. So Shannon, if you come up and say a few words, thank you so much.
Good morning. Thank you so much, Chris. On behalf of Dr. Karen Duncan, our CEO and President of JPS and Health Network, we are so proud to serve as presenting sponsor for today's event, especially in regards to this crucial conversation that we have in regards to health disparities in Tarrant County, in particular related to maternal health. As you know, and actually as Dr. Flynn has just mentioned, the numbers are staggering, not only nationally, but in Texas, in terms of our maternal mortality rate. It continues to grow increasingly, but especially in particular 3 times among Black women. This topic is very near and dear to Dr. Karen Duncan, and it serves as a priority for JPS. That's why we're here today to present as a presenting sponsor. At JPS, our mission is to care for the most vulnerable populations. We serve all communities, which includes those who have financial, social, and health barriers. We know there's so many factors that really prohibit everyone's care. And so for that, we serve as a safety net for thousands of people in our community, which they depend on us for not just for care, but for support and to meet their health needs. As you know, JPS is embedded throughout our Tarrant County community, not just in 76105, 76104, but throughout our community, especially in our vulnerable communities. And as part of our strategic plan, we're committed to being the leader in access, reducing those health disparities, but also producing substantial health outcomes. We have identified our women's need as a strategic priority, and we're committed to meeting the needs of the whole woman. That's from prenatal to childbirth services and well woman care through every stage of life. At JPS, we actually deliver about 5,000 babies annually, which accounts for 20% of the deliveries in Tarrant County. We're committed to help parents prepare for their new family members and ensure that every child at JPS is born with the best possible life. A few of our signature programs include centering programs. We actually were one of the first in the state to be designated a center program. And which is really brings women around for a community feel as they go through their birthing process. They get nutrition classes, they get health and wellness, just a peer support group, and then they come back when the babies are born for their postpartum care. Through a partnership with Morris Foundation, we have a high-risk pregnancy care coordination. This is for women who have wraparound services who are identified as the most vulnerable patient populations to ensure their care. Mom and baby. That is for those who have substance-exposed pregnancy or those who are actually parenting children under the age of 6 with substance abuse. And then postpartum care was mentioned earlier. We realized that 12-month postpartum care is so crucial for the mom and the baby. And we provide that support through our behavioral health services. JPS, we also have a vision to partner purposely. And I'm so proud to see Regina Williams here and our partnership with United Way of Tarrant County to bring teen birth to Tarrant County. We're one of the first in the state of Texas to really launch this program. And what it is so simple. It improves communication for the mom and baby and their family during labor and delivery. It's so simple to bring the mom's voice to labor and delivery. What a concept. JPS is dedicated to improving health access and healthcare for all women. Our focus is very simple. We meet those who need it most. And by reducing those health disparities, we meet the needs for all. We are so proud and look forward to this healthy conversation and to hear from our esteemed panelists. And we're very proud of our very own Women's Chair, Dr. Stephanie Carson-Henderson, who's representing the network today. Thank you again to family publisher Chris Cobbler, to health reporter David Moreno, Sonia, Jody, and the entire Fort Worth Report team for putting on this crucial conversation for our community today. And we look forward to the panelists. Thank you all.
Thank you so much, Shannon. It's our sponsors who make this free event and our free journalism happen. We think it's really crucial that our journalism be free to everybody to have an informed citizenry, but it's not free to produce. So we really want to thank our sponsors to make it happen. Our other sponsors today are North Texas Community Foundation, BNSF Railway, Lockheed Martin, Real Estate Council of Greater Fort Worth, Cook Children's, Mental Health Connection of Tarrant County, and of course, United Way. So please give all of our sponsors another round of applause. I also want to thank all of our members, all of you, everybody out there who contributes at whatever meaningful level as possible to our nonprofit. We're proud to report we're up well over 1,625 members now. We have over 65,000 people reading our various newsletters. We're growing at about 2,000 newsletters a month. I mean, we are really on a roll, and it's because of all of you who care so much about our community, because that's what we're doing, is trying to connect our community through trusted local news and information. But let's get to today's event. David Marino is one of our rock star reporters, health reporter, and I'll let him take it away. Thank you so much, David.
Hello, good morning, everybody. I want to start off by saying thank you, Chris, thank you, Flynn, thank you, Shannon, for the opening remarks. Like Chris mentioned, I'm the health reporter here at the Fort Worth Report, and it's an honor and a privilege to get to moderate this conversation centered around a very important question. how do we improve the health of Tarrant County mothers? It's a simple question, but it requires, multifaceted, complex approach, and there's different parts to what that question really means. And so I would like to introduce our panelists to discuss maternal health here in Tarrant County. As you heard from Shannon and from Dean Flynn, there's a lot of great progress being done. But I think to really paint the full picture, we have to talk about where we've been, where we are now, and then where we need to be. So I want to start off by introducing Dr. Shannon Combs, a gynecologist at Cook Children's Healthcare System. Good morning. Then we have Dr. William Brian Bird, Director of Tarrant County Public Health. Good morning. Amy Haley, Vice President of Professional Services at Texas Health Harris Methodist Hospital Fort Worth. Good morning. And then last but not least, we have Dr. Stephanie Carson Henderson, Chair of Women and Infants at JPS Health Network. So since we have a lot of ground to cover, just some quick, housekeeping rules. There'll be some questions geared towards the group, some towards individual panelists. So we have a lot of ground to cover. We have not move too fast, but also, make sure we have time for my questions, and then we had some reader submissions as well. So this first question is geared towards the group, but Dr. Bird, I'm going to start with you. Like we've heard, high maternal mortality rates in Tarrant County have been on the public's radar for more than 5 years, especially with the revelation that Tarrant is home to the zip code with the lowest life expectancy in the state. My question, Dr. Bird, and for the group, is how did we get here, and how did this become a community crisis?
Thank you, David. And let me turn on my microphone. Can you hear me now? Yes. I didn't know that. First of all, thanks to the Fort Worth Report and everybody for being here this early in the morning. I want to point out that Dr. Giovanna Merriman is here. She's one of the great leaders at Tarrant County Public Health. She leads our, let's give her a round of applause. She leads our WIC programs and our nurse family partnership programs that are doing great work. And she's been a tremendous help to me as I've been settling in over there. So thank you, Dr. Merriman. Let me start by, and yes, Stuart, you did take some of my thunder and some statistics. So I'll truncate it a little bit here. And this, David, there's some hope here. I think there's some great work that's being done. So and here's some important statistics on this problem. So 27,000 births in Tarrant County. On average, per year, there are 7 deaths in Tarrant County that are related, that we would put into the category of maternal mortality. And so what do we take from that? A couple things. One is, because that numerator is as small as it is, we have to be careful looking at rates year over year, right? So we have to look at what's called a 5-year rolling rate to really get statistical power in what we're looking at here. And here's the good news. And this is CDC data that the folks at Tarrant County Public Health put together. Things really shifted for us in 2020. Our rates prior to 2020 in Tarrant County were worse than the state of Texas. But after 2020, thereabouts, and again, this is a 5-year rolling, and so we can't really pinpoint it very well. But then they improved in Tarrant County compared to the rest of the state of Texas. And in fact, the only county, if you look back from 2018 to 2022, the only county major county in the state of Texas that has a better rate than we do is Travis. We're outperforming all the other counties. There's a couple of, just maybe just a couple other things to take from this data. One is that since that numerator is where it is, we can really drill down into the cause of this, and we're doing that. And I'll just finish with this. In 1900, yes, I went back and looked this up. The maternal mortality rate was over 100 times what it is right now. And that's because the people to my right and my left know what they're doing to keep human beings safe through a pregnancy. And I think it's imbued us, rightly so, with this notion that this really needs to be a hopeful, joyful time in our lives. And so I applaud the work that the coalition that Mayor Parker is doing by helping us connect resources, and we'll talk about that a little bit later. And I hope we also get to talk about what are some of the underlying causes behind the deaths that we're seeing here.
Absolutely. Thank you so much, Dr. Bird. And to your point, we'll get to a lot of that. You mentioned, after 2020, we started seeing, better rates. But can you help us provide a little bit of context of prior to 2020, what was fueling these high maternal mortality rates in Tarrant County? Dr. Bird or any other panelists want to kind of address, great progress being made, but just to provide context on what we were 4 years ago.
So I think one of the things we have to keep in mind 4 years ago is obviously we all had COVID. And so that really started giving us an opportunity to kind of think of how to change things. But prior to that, I think a lot of the issues were the disconnectedness. Hearing about all these services, and I'm loving hearing about Parent Pass, is we have all these services, but me as a physician, I didn't know to tell where to tell women to go. And on the flip side, women didn't know where to go. So I think a lot of that disconnectedness. And so I'm hopeful that as we bring ourselves together and provide these resources for patients, because it can be transportation, it can be food issues, it can be housing insecurity, it can be all of those things that, in a 15-minute visit as a physician, that's kind of hard to cover all those things. But to connect with the community and the community resources that are out there, because there's people doing good work, I think that is what is trying to help us move forward, is bringing that connectedness together.
Absolutely. Thank you so much. And so Dr. Berg mentioned, other underlying causes to maternal mortality. Dr. Carson Henderson, is there anything else you can add about underlying causes of high maternal mortality rates, not just in Tarrant County, but let's say across the state, across the country?
Yeah, I think one of the biggest challenges that we have is truly access to care. Just getting the patient in the door. We know that when they're within our walls, we provide phenomenal care and outcomes are better, but getting them from the home into care is one of the biggest challenges that we have faced, made worse by a pandemic that happened worldwide for us. And so I think that's one of the biggest challenges that we have had, is just truly accessing the care.
And I know, Dr. Dean Flynn explained, maternal mortality affects Black women more prominently than white women and other ethnicities. Can you kind of elaborate, Dr. Carson or Amy as well, how maternal mortality or just disparities impact Black women more prominently?
Part of it is underlying conditions that we know are at higher rates in certain ethnicities, like our Black and Latino moms. We know that we do have higher rates of hypertension, most of the time undiagnosed or undertreated, diabetes, obesity. The underlying conditions really do contribute to making the healthcare challenging to deliver to the mom.
Amy, anything you'd like to add?
Excuse me. I do agree, and I think that the difference in where we are today to previous is we've known a lot of this. We know the underlying diseases, and so when the groups would get together, we can't fix that. These women have underlying diseases. They have, there's problems with access to healthcare. But just recently, and as everyone has said, 2 years ago with the coalition, that the community came together, and we can't change what we have in our community, but we can work together and we can make the access easier, and we can give them the tools and the resources that we need, the providers, as well as the people of the community that need the care.
Absolutely. And staying on the topic of the coalition, as Dean Flynn and you mentioned, Amy, the coalition was launched 2 years ago, actually, in September 2022. Can you elaborate a little bit about how the coalition measures success as it continues to make progress in maternal health?
Yes, and I just, as I said, I've been in healthcare for 36 years. Don't do the math. But and all of it in women's health. So I've seen it, and living in Tarrant County, I've only worked at Texas Health Resources. So again, previously we would get in the room and we try to come up with strategies. But this coalition is different, and it was we're going to have action, as they said, the mayor looked at all of us in the eyes and said, you will make changes. And we were like, yes, ma'am. And, but pulling together everybody and coming up with the resource map, that resource map is amazing. I mean, it has resources, again, being in healthcare for 36 years, there's things on it that I didn't even know we offered to the community. So using that, the Parent Pass app, the facilities, as I mentioned, we're doing a pilot at the facilities in Tarrant County to help moms get that app while they're in the hospital, when we can have control kind of what they're doing and show them how they can use it not only before delivery, but during the process and then afterwards. So we're monitoring how many people are getting access to that. But I think every year moving forward, we're going to see improvement in these numbers.
Absolutely. I know every organization that you're all a part of is part of this coalition, so I'm opening it up to other panelists as well. Additional question I had about the coalition is, how do you outreach to these communities, most vulnerable, 76104, 76105s? How does the coalition and your respective, health systems work to reach these communities most effective? Bertie? Since you're jumping on.
It's sort of my turn. One of the charges that the state of Texas has given to public health departments is to connect people with resources, with health resources. I met some people yesterday that are part of an organization called Unite Us. It's similar to the Parent Pass thing. It's just probably a little more matured out. But, the state of Florida, HHS, pays for this so that pretty much every hospital in Florida, for example, when a patient comes in, they receive a SDOH, a social determinants of health evaluation. And if the person doing the evaluation feels like, this person needs help with transportation, they enter into the Unite Us portal. It's immediately connected with a community health worker, immediately connected with resources. And those resources then are reaching out to that person. And I think it's based on the little bit that I know about this group, I think it's a better way of doing it than just saying, here you go, here's the resources, give them a call, and you can get some help there. And so these kinds of technological solutions, I think, are quite important to us. I was looking at, there's a great 30-page report that the coalition put out, and Amy's right, it lists out all the resources that are available to human beings. In addition to listing the resources, it showed how much they're being utilized, and they're being underutilized, particularly when it comes to mental health. And we've talked a little bit about the causes. Yes, diabetes, hypertension, obesity factor into this. There is peripartum risk with bleeding and infection, but it's the postpartum depression, substance abuse, and suicide that are real causes of this. And so we've got to do a better job of connecting people with mental health resources. And I think Parent Pass and some of these technologies are a step in the right direction.
And speaking of, mental health, you mentioned Parent Pass and other technologies as an opportunity. How else can, we improve access to mental health services? Dr. Carson Anderson, why is that important? And how do we continue to, again, not only increase access to women's care, but also mental health access?
Well, we know that up to 60% of women can experience some form of postpartum depression. And this isn't something that magically goes away by their 6-week postpartum visit. This is something that can persist well into that first year postpartum. And so closing that loop is what is so important for these moms, not only offering the resources, but know that they are accessing them. And I believe it was Dr. Flynn mentioned that with the Parent Pass, with the coalition, part of those metrics is making sure that that loop is closed, not only with the resource offered, but did the patient obtain it. We are doing similar with our pilot program at JPS with these care navigators, with the community health workers that not only identify the risk, identify the potential for postpartum depression, but are also providing that direct link to the patient, whether it needs to be a virtual appointment, whether it needs to be transportation assistance to get to the appointment, and following up with the patients between visits, knowing that they are continuing to access that care that is so critical in that year postpartum.
Thank you so much. Now, I want to turn it over to Dr. Combs, because we've spoken about maternal health and how it impacts mothers. But, you work at Cook's Children. Can you explain and elaborate, how maternal health also, poor maternal health outcomes impact infants and newborns?
Yeah. So one of the things that I always point out is the mother is kind of the center of the family. So when you lose that mom, you lose that center. So that has such a broad impact on the entire family, on the children, on the significant other or partner. And so it's so important that we really focus in on moms. So some of the things within Cook Children's that we do is all of our pediatricians, moms don't go to their postpartum visits. It's probably one of the most underutilized visits of healthcare because they're taking care of a newborn baby. And maybe they have a couple of other children. They can't figure out how to get themselves, but they will get their baby to healthcare. And so our pediatricians actually screen our postpartum moms for postpartum depression using a standardized tool that we call the Edinburgh scale. And we're at about 75% of our pediatricians screening our moms. Of course, the mom is not in the healthcare system, and so we're not able to kind of keep that in the records, but if the pediatricians identify something, then they're able to refer the mom out for resources and things like that.
And what are some ways and initiatives to, you mentioned mothers don't go to their postpartum appointments, they take their infants to make sure they're okay. What are initiatives or what are ways to push mothers to say, your care is just as important, you need to take care of yourself?
Yeah, I definitely always, I currently work at Cook, but I've worked with full scope obstetrics before. And one of the things I always tell my moms is you can't fill from an empty cup. And so if you don't take care of yourself, you can't take care of your children. And so you are important too. It's not just your child, and your child's not going to do well if they don't have you to take care of them.
Thank you so much. I want to go back to you, Dr. Berg, because you mentioned, the Tarrant County Public Health, the department that serves most communities here in the area. Can you tell us a little bit more about the public health department's responsibility in ensuring mothers are healthy, and what are some ways that you became director earlier this year that you're really pushing to say, here's where we can grow and do better?
So Tarrant County Public Health has two programs that primarily focus on maternal health. The first is the Nurse Family Partnership, and we have RNs that are very well trained, and each works with up to 25 pregnant moms, and they stay with them for 2 years after delivery. They coach them, and they love on them, and they're with them, and things just go better. I got to join one of our nurses during a visit with a mom and dad. There's a little 1-year-old running around, and a pregnant mom's crew. It's not unlike the doula program that United Way Tarrant County is standing up, and which I think is fantastic. And the data on doula loss is really great when it comes to preventing preterm deliveries. It's really great in other ways, and so that's just a fantastic move by United Way. So thanks for that. Just another example of how many great organizations and partners we have working here in Fort Worth and Tarrant County. And David, the other big program we have is Women's, Infants, and Children, WIC. I have visited all 7 of our WIC clinics and sat down with all of the amazing people that are working with moms and families on nursing, getting formula, taking care of themselves, as we've said, and taking care of babies, and they're doing fantastic work. And they are busy, man. Those are busy. They are running over there. So there's tremendous need for that. And so for us at Public Health, we have to we're always continuing to assess that we're a growing county. This is a little bit tangential, but I want Tarrant County Public Health to have a seat at the economic development table. Why is that? Well, because we need more companies here that provide good health insurance for families. So there are a number of ways that we are looking at expanding our programs as our population in Tarrant County grows so quickly.
Thank you so much. You mentioned doulas, and Amy, can you kind of elaborate more about, for people who aren't familiar, what a doula's responsibility is and how they play a part in improving the health of mothers?
You saw me going towards my.
Yes, so I'm not saying that.
Yes, doulas, so I just working in the hospital, doulas, they just have a different, I guess people think of them differently. They are community trained providers that help women, pregnant women, pre-delivery, during delivery. What I think people don't understand is the post-delivery. There's a thing called, it's not real new, it's called the fourth trimester. So you have, the 3 trimesters of delivery, you deliver the baby, and then everyone's like, oh, everything's great, well, it's not. And as we see through the numbers, that 4th trimester is really important. And this is where doulas really come into play, because as Dr. Combs said, the women don't go to their appointments. They're busy taking care of their other kids, they're, working their job, whatever they're doing. So they don't go to their appointments, so the doulas can go to them. They can go to their house and do an assessment and make sure everything's okay. And again, not just for the mom, they can kind of assess the whole situation and see what's going on. So it's a huge program. I am as well so excited that it's really amping up in Tarrant County, because I think it just, the term has been so focused on the delivery part of it and in the hospital. It's just so much bigger than that.
And Dr. Carson Henderson, I want to turn it over to you to continue the conversation on doulas. I know in previous reporting that I've done, the United Way has told me and said that, when you have community doulas, it makes a big difference. Can you tell us a little about, when you have a doula from a community, from a mother's community, how that makes a difference?
Absolutely. Doulas can just be amazing partners for the mom. And really, doulas are the one person that focuses solely on the mom and the family and the baby, but they can take that journey with the mom. Our families look different than they used to. Long time ago, you could probably walk to every single one of your auntie's homes and your cousin's homes and your grandmother, and everybody supported you in the pregnancy. And that looks different today. Families don't look like they used to, but having a community doula that comes from your community, that comes from your culture, that may speak the same language if it's not primarily English, can make a huge support difference for the mom. And it's an entire journey. It's through the pregnancy, it's through the delivery, like you mentioned, but also postpartum. What things are normal, your body's rapidly changing, your mental state is rapidly changing, you're not sleeping, and really having that partner that will hold your hand through that entire process can make tremendous differences in outcomes for moms and families.
Thank you so much. Amy, I want to go back to you. You mentioned, how doula programs is amping up and really helping to better outcomes. Another way that, you're amping up is Texas Health and JPS are participating in Teen Birth. We heard it mentioned at the beginning. That program is set to launch in Texas Health, hospitals, and JPS in January. So tell us a little bit more about what Teen Birth will look like, and what are the results you're hoping to see come out of that?
So as we've all said, there is so much going on, and Teen Birth is so exciting, and we're so ready for it to get going. As Dr. Combs said earlier, it is so simple. It is basically huddling with your patient and their husband, loved one, provider, and including the providers, so everybody that's involved in the women's care while she's in the hospital, and talking about what the plan of care is going to look like. You have a whiteboard that you write on so that, again, it's visualized for everybody. And it sounds simple, but the outcomes have been amazing. The other the other states that have implemented this have had reduced C-section rate, better outcomes, better satisfaction, not only for the patient, but for the providers as well. I think these 2 OB-GYNs will tell you, I communicate with my patients a lot, but what they say is when you implement Teen Birth, they really step back and go, wow, I really wasn't communicating as well as I could have. So I'm so excited. I think it's going to be amazing for Tarrant County. I had the opportunity of visiting with a family that unfortunately did not have a good experience at one of our facilities. And as sad as I was to sit there and listen, not only to the patient, but to her mother and her mother-in-law and her husband. I mean, I had 4 people telling me how they were not pleased with the care. They were pleased with the care, but the experience, more around the experience. And so again, as I was so sad to hear that we didn't meet their expectations, I was sitting there inside cheering because everything that they were telling me, I was checking the box that Team Birth was going to help with this. And so communication and transparency and it's just, closing the loop again at the end of the shift with the family. So we're really excited for it to be implemented.
So thank you so much. Dr. Carson Henderson, anything else you want to add about what Team Birth Initiative means for John Peter Smith, for JPS Health Network?
Well, I echo everything that you said, but in addition to that, I think the single most important part of Team Birth is that it will truly include the patient in her care. We will ask the patient, how do you hope this process goes? What do you think about what's happening, as opposed to what was a traditional model for so long? The obstetrician or the provider would go in and say, this is what's going to happen next. And you would have to run out and go back to clinic, and it's always running. And so really being able to incorporate the patient in the journey of her care is going to be so important. There's going to be these large boards in the room that have the entire team listed on there. And one of the first things I said is, at the top of the board is the patient. It's not who's the nurse, who's the doctor, what's the shift, what's your feeding preference, it's the patient. And so remembering that at all times is what I think will truly make that difference with Team Birth for us.
So thank you so much. And with it launching in January, how will you measure kind of the impact and will there be like yearly data released on the Team Birth Initiative? What would that look like to ensure that progress is being made?
Well, one of the ways we're going to measure is every patient that at our facilities will get a survey before they're discharged. And so we will immediately know that, because we input that information into a database that the Team Birth colleagues will help us. So we'll get that immediately. And then we'll just continue, at Texas Health Resources, C-section rate is front and center as one of our key performance indicators. So we will just monthly continue to watch our outcomes and hopefully see a decrease in those.
Thank you so much. So we've had the chance to really speak on, local efforts. Coalition is doing great work. Dr. Combs, I want to turn over to you. There's great work being done, but there's always room for improvement. Is there anything you think on the state or federal level that can help continue to make progress? Anything to kind of speed that up?
Actually, talking about mental health, we all know you can't get a mental health provider. So that's one of the biggest challenges, is being able, you diagnose postpartum depression, now what? So one of the initiatives actually that the state has done is called PeriPan. And so as an obstetrical provider, it's a hotline to a local, to a psychiatrist, so that, you can get recommendations so that you can kind of be the intermediary if you can't get patients to a psychiatrist or a counselor right away. So I think that's a great initiative on the state level. It's originally piloted in a couple of areas, but now it's broadened to the entire state. And so I think that's a huge initiative. Also within Texas, we extended Medicaid 12 months postpartum at the last legislative session. The problem with that is some people don't know about it. And on the flip side, there's also issues with enough providers who take Medicaid. And so really trying to work with our legislative advocacy about, unfortunately, sometimes it does come down to money. If you make 40 cents on the dollar, you can't keep your doors open. So I think working with our legislators about trying to increase payment rates for Medicaid so that doctors' offices can stay open. Because what we've noticed is a lot of providers who are out there, they take Medicaid, but it's a very limited number. And so trying to get a patient into an obstetrician, they got their Medicaid, they found out they're pregnant, but they can't find somebody to go to. So I think that's one of the things, legislatively that we can look forward to in the upcoming session.
Dr. Bird, I want to turn over the same question to you. As the director of Tarrant County Public Health, are there other initiatives on the state or federal level that can kind of help continue progress along the way?
David, I was visiting with Dr. Jennifer Schuker, who is the commissioner for the Department of State Health Services down in Austin, about this very issue. What they're looking at a state level is where are the bottlenecks? And we just talked about some. we primarily talked about three. Encouraging young women who are pregnant to get prenatal care early on. We're good about getting prenatal care in general. We need to do better about early prenatal care, where we can test, treat, vaccinate. We can treat the hypertension, at least the preeclampsia. That's serious business. That kills people. The second bottleneck was providers. The third bottleneck is funding source, running so Medicaid. And I was visiting with Dr. Duncan about these three bottlenecks, and she said, "Hey, look, for the people that can make it here to us, we'll take care of those last two, right? We'll make sure that we get them on the process of being on Medicaid. It takes a few months, but we can get that going." And the second piece of that was we still have capacity here. But then when I was talking to leaders in Arlington about this, Arlington's second largest city in Tarrant County, and they said, yes, but a lot of our folks can't get there. There's a transit problem, right? And so there's work to do on all kinds of levels. And I think transit is a place where we haven't figured that out yet.
Thank you so much. So I have one more question for me, and then I'm going to send over to some reader submissions that we received. This one is for the group, and I'll start with Dr. Combs, and I'll make the way down for each of you. We've discussed the past 5 years. Now let's look ahead. What's going to be different in the next 5 years?
In the next 5 years, I want women to be able to get access to care early in pregnancy and to be able to continue that care throughout the pregnancy. And if there's complications or health issues afterwards, to also be able to continue that care. Because, it's oftentimes women, when they have a baby, it's like, oh, there you go, there's the mom over here, we'll take care of the baby. But we really do need to focus on women afterwards and continuing their care, because women don't always die in that first 42 days. They can, die a year later, and yes, it's related to their pregnancy. So hoping to see improvement in those areas, because I think that's how we improve maternal mortality.
Thank you so much. Dr. Berry, same question.
Yeah, we need to do a better job of making sure that pregnant moms have somebody with them along the journey in the delivery room who looks like them. That's really important. And when we look at, when we do interviews and we say, how did it go? And was this traumatic for you or not? That's the main indicator. And I think all of us, we hear that and we go, yeah, that makes sense. I feel more comfortable when there's somebody who looks like me because they're probably going to get me better than other people in here.
And a quick follow-up, just because the importance of having physicians who look like patients. How does Tarrant County, what can Tarrant County do to diversify and help continue to diversify what its providers look like?
Well, I think that probably the biggest move on this is United Way's doula effort. I think it's going to be fantastic in that regard. It doesn't have to be the physician. But to your point, we have not moved the needle on diversifying medical schools from an ethics standpoint. We have a lot of work to do.
Thank you so much. Amy, same question to you. What's going to be different in the next 5 years?
Well, we know the growth is incredible. Tarrant County's projection and the surrounding areas, the growth. So it's going to get bigger. There's going to be a lot more patients. Being a TCU alumni, and yes, I don't want to talk about their football season right now. I am so excited for the TCU School of Medicine. I feel like, as I mentioned earlier, we have our patients, they have underlying illnesses, and that's what it is. But having TCU in the community, partnering with UT Southwestern, those amazing groups, and already work being done on how they can take care of some of these patients and try to help with some of these underlying issues. So I think that's great. And then I think the other thing is just seeing everybody in this room wanting to hear about this major topic. And I think if we keep the excitement going and get more people involved and keep the coalition going and keep the partnership, I think everybody sitting at the table walks out of the room saying, we're going to do something about this. I think it's gonna be great.
Thank you so much. Dr. Carson Henderson?
So I think in the next 5 years, two things that will be critically different. Number one will be care navigation for every pregnant patient. If we can have that community health worker, the doula, whoever that partner is that continues to connect patients with resources is critically important. An ideal state would be to offer that to every pregnant patient. Number two is the extended postpartum care that Dr. Combs alluded to and spoke about. If we can continue that healthcare postpartum such that every pregnant patient enters the next pregnancy even healthier than the last one, that would move the needle.
Thank you so much. Now, we had a couple of reader submissions, and I wanted to make sure I had time to ask those. So I'm going to ask them, and then if any panelists want to just kind of jump on in. One of the first reader submission questions we had is data showcases how maternal mortality affects Black women more than double comparison to white women and other ethnicities. Where do Hispanic mothers fit in the maternal mortality data locally? Dr. Murray.
I have it here.
You brought the draft.
Go ahead.
Yeah, so if you look at, okay, here's Tarrant County. This is a 10-year maternal mortality rate. And the Hispanic rate is lower than the non-Hispanic white and non-Hispanic Black rate here in Tarrant County. That's, yeah, I'm sorry.
And that is one of the things that's kind of the confusion around maternal mortality, because we see such this increase in African American women. But in Hispanic women, this is kind of the one area in healthcare where there's some sort of protection. They tend to have lower mortality rates even than white women. So if we can figure out what they're doing right, then maybe we can expand that.
Yeah, I was going to ask you, do we know why that is?
Yeah, that's, we theorize that it could be related to culture and how families are within Hispanic culture. I always say it takes a village to raise a child, but it also takes a village to help that new mom out. And so I think that's part of the underlying issue, but it's really hard to kind of pin down exactly, just like it's hard to pin down why African Americans have such a high rate. It's not a single thing, it's a complex issue.
Thank you. Anything that maybe Dr. Carson Henderson? No? Okay, cool. Another reader submission question we had is, it kind of relates to the Medicaid question, the statement you made earlier. Somebody asked if the leadership in Texas would secure Medicaid funding, would that help reduce the mortality rate? Dr. Combs, I don't know if you.
I would hope so, because, that's the problem. We've extended Medicaid postpartum for our moms, but the problem is, they need an endocrinologist, or they need a cardiologist, or they need a nephrologist. And specialty care for Medicaid is very hard to get. And so I think if we could increase funding for that, those physicians would be able to take care of those patients.
Thank you so much. Another reader's question we received was similar, was related to the social determinants of health. How does, I guess, addressing social determinants of health reduce maternal mortality rates? You kind of mentioned it, but is there anything else we didn't discuss about kind of how addressing social determinants of health reduce rates? I know Dr. Bird mentioned transit, any other ways?
Well, it makes a tremendous difference when you do address the social determinants of health, because it's not just a matter of whether the patient's in care or not, it's a matter of how she accesses that care. So truly addressing things like transportation, which is one of our highest, that's a challenge, but providing those travel vouchers if you don't have a bus stop in front of your house can make a huge difference. Also, addressing things like food insecurity and housing insecurity. Sometimes patients can be so worried about those chronic issues in their life that they're not able to get to the appointment. So really addressing those social determinants, which I think we're getting better at. We're not fully 100% there yet, but providing those food banks right outside of clinics, providing the vouchers, providing resources for housing can make a huge difference.
Thank you so much. And then another reader submission question we had, and I think this is a good one for everybody to answer, is how can the community, people who are in this room, become involved to help improve the health of Tarrant mothers? Amy, we'll start with you. What can the community, people in this room do?
come to things like this and hear what's going on. Let's see, I mean, just find a way to get involved. You know, it's a community that has a lot of resources, but getting it out to the patients, sharing the message, you know, like, I think this is the first time that from the coalition perspective, that community groups said, can we come into your hospital and do this? Because before it was, we would sit at the table and take stuff back to the hospital, but now the community resources and providers are saying, can we come into your hospital and help with this? So just find a way to get involved and get the message out of all the activity that's going on.
I think that raising kids, and it's just one of the great privileges we get to do as human beings. It's also pretty much the hardest thing we do. It was really difficult telling my wife, Stephanie, and she's an executive, she's an attorney, she's a pro. But, you know, having 3 kids and going through that was just, particularly when they were young, and we went through all the stuff, you know, and we also had a lot of resources, so it was easier for us than other people. And one of the things I do when I'm in public, the grocery store, I particularly do it to young dads, and I'll just go to and I'll say, you know, I'll see a dad at the grocery store with a couple little people in tow, and I'll say, way to be a good dad, man. Keep doing it. I see, I've done that once to a woman. I thought she was going to hit me, so I don't do that anymore. But if you're a woman and you see young kids, way to go. You can do it. It means you. This is probably one of the most important things we do as human beings. And it takes a long time, man. It takes 18 years to make a human being who's ready to go. Well, yeah, probably longer. It's a heavy lift for us. So that's why it's good for us to come together, get behind each other, encourage each other.
Dr. Combs, any question for you?
I think one of the biggest things is continuing that community afterwards. I always marvel at the number of people that come in for a delivery or postpartum, and it's like this crowd of people for about the first 2 weeks a lot of times. But what happens at 2 months or 3 months, and when mom has to go back to work, and different things. So I think one of the things, you know, as community and as people is, you know, when you have a mom, you know, touch base, like, what do you need? Because everybody's focused on the baby. Oh, I got some onesies for you. I've got diapers. I've got all this stuff, which is helpful. But also, what do you need, mom? You know, giving them a night off, letting them go get a massage, or heck, even a shower sometimes. But, you know, I think really focusing in that it's, you know, everybody's there right at the beginning. Where are you down the road?
Dr. Carson-Henderson?
So I think first and foremost is just awareness of what is going on in our local community with the rates that have been so well identified today. Awareness goes a long way. Number 2 is not being afraid to reach out to whoever you know, whether it's somebody in your job, whether it's somebody at your church. Everybody knows somebody who's pregnant, and it's not only okay, but I would encourage everyone to just reach out and say, how are you doing? Are you obtaining prenatal care? This is hard. It's okay to say that to another mom if you've been there, or if you're a dad, it's okay to reach out in the grocery store, maybe to dads. I don't know. There's a responsibility there, but you know, awareness, reaching out, don't be afraid to ask, how are you doing? That can go a long way.
Thank you so much. And I was looking at the time, we finished right at 9 a.m. We always promise never to keep you too long, so I think I did a pretty good job at keeping this short and sweet. But I want to appreciate our 4 panelists, Dr. Combs, Dr. Bird, Amy Haley, and then Dr. Carson-Henderson for taking this opportunity to discuss maternal health here in Tarrant County. And like I said, I want to echo what they said. The conversation doesn't stop here. There's a lot of great efforts being done. It's important to keep the conversation going outside of the room. I know I will in my reporting, so I look forward to continue to follow maternal health efforts here locally, and hopefully, if you want to be part of the story, let me know, and we'll get in touch. Thank you so much.
Well, I'm so inspired by our Candid Conversations. Thank you all so much, and to our panelists. Really important conversation, and I always feel much more encouraged, actually. I mean, it's a tough issue, but when I hear all these smart people and I'll see all of you thinking about this issue, I feel confident about our future. So let's give David and our panelists all another round of applause. And I want to thank again our sponsors, and especially our JPS, our presenting sponsor. Thank you so much. I want to let you all know too that we have a coming really important Candid Conversation December 3rd on the how do we turn around the Fort Worth Independent School District. I think people will be real interested in that one. We have Pete Guerin on the panel. We have our interim superintendent Karen Molinar on the panel. We have Roxanne Martinez, our school board president, on the panel. So hope you all will put that down December 3rd. We're going to start in the evening because our educators are busy this morning. I've done a lot of mornings, but they'll 5:30 to 7, December 3rd. We have sponsorship opportunities available for that too. Jody Newton is right here. She's our Director of Corporate and Community Relations. She can help you out with that. We also, I know after thinking this hard, your brain power really requires a lot of calories. So you need to go check out our Fort Worth Eats book. We have got a lot of great coupons that also help support our journalism. There are lots of different ways to support our journalism, and we can help you in every which way you want to do that. Other events, just to let you know, coming up, we have a listening session. We'll be over at TCU for that, a community listening session. We've done this now. We are 3rd year of just going out and kind of turning the tables on this. Our community is at the table, and we're listening and hearing what's important to them. Really excited about that. Actually, English at TCU works with us on that. And then we have a Candid Conversation. This issue came up a lot in discussion on mental health. That will be February 27th. So stay tuned. Go to thefortworthreport.org. Read coverage of this event. Look at the live stream, and be sure to sign up and become a member and supporter of the Fort Worth Report. Thank you so much.